or in combination with the oral contraceptive pills, which is an anti-androgen medications for acne and other associated symptoms. If a patient is a lean adolescent girl, the doses as low as 850 mg of metformin is effective. And in overweight, the dose can escalate to 1.5 to 2.5 grams daily. Now, moving on from PCOS to another phase of hormonal imbalance is thyroid function. During the health checkups, we have seen that during TFTs, especially during pregnancy, are crucial as these during thyroid profile can lead to further complications in pregnancy, like preterm delivery, low birth weight babies, gestational hypertension. So in these cases also we have to evaluate TFT like T3, T4 and TSH levels along with the free available thyroxine so that we could evaluate whether the person is having hyper or hypo during her pregnancy trimesters. Each trimester is, we need to evaluate during each trimester. These TFT holds a important role. Aim is to keep TSH level below 2.5 MIU per L, in fact, in the first trimester. In second trimester and the third trimester, the values of TSH is variable and needs to be further discussed with the doctor. So after hormone, like thyroid hormone, I would like you to see another phase which is very important in a female who is suffering with amenorrhea, very less periods, and we need to evaluate our other nutritional and multivitamin deficiencies like vitamin D, calcium. So as we all know that all women with amenorrhea should be sure to consume 1200 to 1500 mg of calcium daily and a vitamin D supplement 400 IU or 10 micrograms daily. This occurs in hypothalamic amenorrheic cases where there is preliminary amenorrhea due to other factors like emotional stress or behavioral pattern or environmental or genetic causes. Acne, another hormonal imbalance feature which is there. The contributing hormones are testosterone, dihydrotestosterone, which is 10 times more potent than the testosterone, then dihydroepiandrosterone, progesterone, glucocorticoids, ACTH, insulin and insulin growth factor 1, growth hormone, cortisol releasing hormone, prolactin, vitamin D. These tests need to be evaluated and given to the person to know about the exact causative factor leading to acne. These are on the slide, you can see some of the values which can be correlated along with the normal ranges given. Next is another middle age crisis, which is ovarian insufficiency. In this, what happens is the ovaries, generally ovulation is there in every woman, but a woman stops ovulating by the age of 50 years. This is called menopause. But if a woman stops ovulating before age 40 years, this is called primary ovarian insufficiency. Now here comes the role of anti-Mullerian hormone, which depicts the ovarian reserves, and FSH. These are the investigations being done during of life. Premenopausal symptoms also gives us the hint that person is lining up into some insufficiencies. I would not say that these are the ovarian sex hormones. I will say estrogen, progesterone as the ovarian hormones because they not only give us the clue about the reproductive status, but they also give us the other contributing to bone health and to the mood changes and to the central nervous system activating other metabolic syndromes also gets affected. So these are the ovarian hormones to be tested. Mostly the hormonal therapy is given, such as birth control pill to prevent or treat many such symptoms of menopause, such as hot flashes, vaginal dryness, osteoporosis. It can be given till a woman reaches the age of 50. Further markers and scanning can be helpful during this phase of life, like DEXA and FRAX tools, which are also recommended. Till now, we have discussed about the amenorrhea and PCOS and some of the other factors, hormonal imbalances, which occurs at various stages. There were less lack of menstruation in most of them. Now we are going to another topic called dysfunctional uterine bleeding. In this, most of the time, there will be variations, a phase of less periods to a phase of heavy bleeding. This could occur and it's very common in every woman. Every woman mostly will face this at one or the other stage of their life. So this type of abnormal bleeding occurs either due to fault in the ovaries or disturbance in the hypothalamic pituitary axis, where there is unopposed effect of estrogen on the endometrial lining of uterus, leading to amenorrheic phase of 6 to 8 weeks. In this, there's no negative feedback, but there's from FSH, there's disturbance in the rhythmic secretions of estrogen gonadotropins. After a prolonged period with a lowering of estrogens, later endometrial shedding occurs, further causing excessive bleeding. This is how we understand when a person comes up with DUB. Causes may be many. Even an endocrine hypothyroid patient can come up with DUB, symptoms like DUB, which is disturbed uterine bleeding. Pelvic pathology is commonest, like fibroid uterus. Most of the time, the unopposed estrogen causes fibroids in the uterus, leading to excessive bleeding. Adenomyosis, again, the musculature of the uterine wall gets hypertrophied. Adenomyotrosis. Endometriosis is commonest in cases where the woman presents with the painful vaginal intercourse, and there could be dysmenorrhea as well associated with pelvic pain. IUCD in utero can cause DUB. Chronic tubo-ovarian masses. In India, mostly there will be the pathology of tuberculosis and endometriosis, which leads to DUB. Other systemic functions have to be also evaluated, especially the liver dysfunctions, severe hypertension, hypo and hyperthyroidism, idiopathic thrombocytopenic purpura leukemia, and emotional causes affecting the HPO axis. This was the DUB. Now we will next conclude my session with the last topic called menopause. Next, understanding menopause is as important as the phase itself. We see that there are various symptoms which conclude that a woman is suffering with menopausal symptoms. They are, let's start from the head to toe. Systemically, if you see, there will be headache, giddiness, disturbed sleep, anxiety factor, poor memory, inability to concentrate sometimes, depressive mood will be there, mood changes, mood swings, which we call hot flushes will be there. A woman wants to go out near the window and see how she can get rid of this hot flushes on the face, sweating, excessive sweating, night sweats especially. Then palpitations are there. Enlargement of tenderness of breast is seen. Then itching, drying of skin. There can be joint pains of stiffness, back pain, urinary incontinence, vaginal drying, especially, and sometimes spotting. Now, what is menopause? Here we come up with the definition. It's a physiological phase which occurs in every woman's life when ovaries fail to produce reproductive hormones. Multiple concerns, however, emerge during this time, like vasomotor metabolic, which we have already seen in the previous picture on the slide. Musculoskeletal, again, muscle wasting, joint stiffness could be there, mood swings, and other centrally acting phases of life can be seen. Maturation, there will be stress incontinence. Even while coughing, sometimes there could be the lack of control of passing urine. Some genital tract infections could be seen in few, and malignancy-related issues are seen. How to deal with them? Yeah, they can be managed by a skillfully crafted prescription of lifestyle modification, non-hormonal therapy, and other management protocols, like menopausal hormonal therapy. Now, let's discuss about menopausal hormonal therapy. There was an initiative by the Women Health Initiative, which was done in 2001. In that, it was concluded that menopausal hormonal therapy basically has given some results to alleviate the symptoms. And though there's a use of hormonal preparations in these women undergoing menopause, and multiple preparations were also given to them. But after a while, after some studies, they have concluded that these hormonal changes are naturally occurring and can be dealt up along with the multidisciplinary concerns. So the preferences is and the needs and concerns of a person needs to be also seen along with giving the MHT. We have to also rule out other pathologies before giving the hormonal therapies. It is composed of two hormones, especially estrogen and progesterone. Choosing the right estrogen and progesterone preparations, routes, duration of therapy is cornerstone of successful hormonal therapies. What are the indications when we really have to give the hormonal therapy? The signs and symptoms should be there, exhibiting the hormonal variations, mood variations, hot flushes, dry skin, trophic vagina, irritability, feeling depressed. These are the signs. Again, we need to check and change them. Signs of osteopenia and imaging abnormalities are seen, like the T score and Z score if it is less than 2.5. Sarcopenia, muscle wasting is very important, guys. We generally see only the osteoarthritic knees and knee pains, but we mostly ignore the muscle pain, which especially the hamstring muscle weakness is there while squatting and while getting up from the bed. Sometimes a women have sarcopenia is also to be addressed. These are all symptoms of hormonal imbalances. Lack of FSH will land up into other changes. Now let's go how to manage. The most important, the third key point for this presentation was lifestyle management, which includes 6 dimensions of wellness: physical, emotional, social, intellectual, spiritual, and environmental. Physically, yes, the body's overall needs and condition needs to be addressed. Fitness level, your ability to take care of yourself is most important. Emotional wellness, ability to understand and deal with your feelings. Intellectually, the ability to change your mind and seek out new experiences and challenges will be the cornerstone. Social wellness is as important as intellectual and spiritual. Environmental factors and vocational and occupational care. You believe in yourself. A woman needs to have a proper diet, a proper environment, surroundings, so that she can take care of her health. What are the behaviors that contribute to wellness? We generally, when a person comes to the clinic, we generally address the issue with the laboratory investigations, but we fail to understand her needs, especially when she's able to be physically active or not. So these things are as important as the management. Choose a healthy diet. Again, we tell the person, maintain a healthy body weight. BMI is always checked whenever there's a first visit or the last follow-up visits. Manage stress effectively. Then we have to see whether they have any other disease or comorbidities. We need to take further steps towards the wellness. So reaching wellness through lifestyle management, how we can do that? Getting serious about your health. Yes. Examine your current health status through follow-up and other techniques which are available in the surroundings, in our technologies. Choose a target behavior. It's very important to see how your body reacts and when you have to change it. Find whenever possible. Build a motivation towards change. Examine the pros and cons of change. Boost self efficacy. Believe in your ability to succeed. Take charge of your life. Start visualizing and self talk for meditating people. It is very helpful. Identify and overcome barriers to change. Be fit and well for your life. Take some extra steps, some extra effort, and yes, the paybacks are good with full energy and vitality, which is priceless. But once you have started, don't stop. Health improvement is forever. Deal with easier problems first. Use what you know to tackle more difficult problems later. Hereby, I conclude my talk. Thank you for patient listening. So,
Thank you, Dr. Sumedha,
any
for
questions
such a wonderful.
regarding open to them?
Firstly, Dr. Sumedha, I would like to thank you from the entire team, Assurance by Nano Health, for taking your time out to be here and explain on the importance of women health and what kind of hormonal changes women go through different phases of their life. Wonderfully and in detail, you've explained it along with how really we can take care of it through lifestyle.
Thank you, Dr. Arshita.
We'll open the forum for questions. So whatever questions you all have, you can put it in the chat or you can request to go off mute, raise your hand and you can express out your questions as well.
Yeah, because of the constraint of time, I was little fast in giving the presentation somewhere. Maybe I can elaborate on some few topics which are relevant and concerning your health. Anybody?
So while others are asking, Dr. Sumedha, they're typing or they're requesting, one of the question while I was going through a presentation or which I had, which you could actually go ahead and explain in more detail would be like, what diagnostic tests do they need to include at different phases of their life? So let's break it down into teenagers and adolescents. What kind of tests do they need to go? Or adult working women, what kind of tests do they need to go? Then elderly, what kind of test do they need to go? If that is something you can elaborate upon.
Yes.
And how frequently also should they even get the testing done?
Okay. I will take over that question. Probably the most important thing is to investigate according to the age and the presenting feature. Suppose a female who is just entering the puberty and is worried about her secondary sexual characters as well as some hormonal imbalances are there. We have to first physiologically assess the patient with her BMI testing and thyroid test, hormone test like TFT, TSH, T3, T4 levels, along with some simple vaginal or anatomical examination on inspection we can see. In case there's a lady who comes up with hirsutism and acne and some physical obesity kind of thing, so we need to check and change that also. We have to evaluate the BMI. We have to see the hypertension or hyperlipidemia, see if there is any high BP or any congenital heart problems. Then later of phase of the life, if there's acne and hirsutism, the testosterone levels are high, the pattern is changed, then we have to assess that and check and change accordingly. In cases of early puberty, we have to just check the testosterone and HCG in some, and thyroid TSH-T3. In later stages, we also have to not only evaluate the ovarian functions, but we have to also evaluate the adrenal causes. Adrenal causes like 17-hydroxyprogesterone, dihydroepiandrosterone. They also can take over, lead to amenorrheas in some cases, secondary amenorrheas, which can be actually dealt up very easily. Then third is the metabolic syndromes associated along with the PCOS. Like a female is having acanthosis nigricans, along with obesity, along with irregular periods, along with mentally she's disturbed, and so we have to evaluate in those cases the insulin resistance by a ratio called HOME-IR, and evaluate her, assess her BMI again. Then we can also see the body fat analyzing techniques are there. So we can also check and see the skeletal muscle and fat and visceral fat ratios. Waist circumference in Asian women above 80 centimeter is called as overweight and obese, and we need to that. BMI 25 to 30 is normal. Normally seen that it is overweight. Below 25 is good. Nowadays, it is changed from 25 normal range to 23.5. So a lean body doesn't make picture that the person is healthy. We need to further assess and evaluate. So these are the things. Later half, when a lady is entering the menopause and the perimenopausal phase, irregular periods, and there are some derangements, metabolic derangements like lipid profile, we have to check in those cases. FSH, LH, testosterone, and the ratio between the LH and FSH is also very important. It is in PCOS, it is 3:1. That depicts the clearly picture, giving a clear picture that it is PCOS. Then dihydroepiandrosterone is important in some cases. So these are the tests which are very important and relevant. Menopausal stages, also we have to check 2D echo and cardiac abnormalities associated with thyroid and hormones like FSH, estrogen, progesterone. We need to evaluate that, because estrogen also contribute to the heart health. So we can't skip these important tests like 2D echoes. ECG is very important in some cases, because a pumping of heart is also affected in few. I have seen. And later landing into shortness of breath and other complications of like menopause. Then there could be DEXA scan, FREX tools. These are also very essential part where we have to assess the osteoporosis in these women, because generally these females will come up with risk of fractures and they are not aware of it, but by one scan we can actually assess, and all the management can be done very easily. There is 2 injections and treatment which are followed. Some are only given estrogen unopposed by progesterone. Some are given both estrogen and progesterone, women who are having intact uterus. So these evaluations are necessary and should be done accordingly.
Thank you, Dr. Sumedha, for sharing that so much in detail. So actually, in fact, Assurance to celebrate Women's Day and this entire month, we actually came up with women packages for different age groups as well. And it actually incorporates all these tests which you mentioned. Like for elderly, we have bone densitometry tests, and also we can early detect the loss in calcium in the bones and any kind of fractures and all of it. Those can be detected early, so they do not end up in like age related fractures. So all those who are interested, please go ahead to NH Assurance website and you can check out this women packages, which is based on different age group. There was one more question, Dr. Sumedha, which came on our YouTube, was more about how early and when should they start planning
Okay. How often?
planning
Get the question.
Sorry, the question I was telling was how early should they start planning for pregnancy, and what kind of problems can they face, especially in this working situation when women are doing multiple things? What kind of problems they can face which can delay their conception? So
Yeah,
that would be
that is very.
we have 5 minutes to wrap. Yeah.
That's definitely one of the main important phase of life in a woman, especially when to conceive and how to conceive and what should be done. So essentially, a woman who is obese and having PCOS needs to be treated first with the lifestyle, and the investigations are important in some cases. Some, the women wellness programs are there. Yes, I'm sure your packages will help them not only with their treatment modality, but also with their other wellness coaches who can help them to train them and to make a harmony between their mind, body, physically and mentally, so that they can actually come out of their hormonal imbalance phase. And definitely, while getting pregnant, these women are very anxious. So mental wellness is as important. It holds its own niche. So we need to take care of that also. From my side, I would suggest that first the weight management and hormonal imbalances should be addressed. And in case there is no other hormonal imbalance, it is being managed, metformin can actually regulate and improve the fertility, reproductivity, in vitality in females by improving the ovarian functions, directly affecting the hypothalamic pituitary axis, and assessing every second to third month to see whether the improvement is there with the treatment is also as important as we see during the first visit. So these things are very important and should be assessed timely so that the results are good and quick.
Great. Thank you so much, Dr. Sumedha. That was the time we had for today. It was a great session. We really had a lot of takeaways to take back home, from different testing to different disease names which you took, and when what needs to be done. So thank you so much, Dr. Sumedha, for joining us today for AssuranceTalks. Thank you, everybody, for joining us. You can watch the recording on the YouTube and share it with others who you think can benefit in your family and friend circle. And stay tuned for the next month's Assurance Talks. Thank you.